Hello guys, welcome to SKK Classes Answered again. So, today in our video, we are going to discuss about one of the very much common topic, that is gastritis. I think you people are quite familiar with this topic, that is gastritis. Okay, that what is gastritis? So we will discuss in this video, and what type of signs symptoms of gastritis will be there, and what can be the complications if it's gonna chronic, and what type of treatment that should be provided to the patient or a person if he or she is suffering from gastritis. So let's discuss about the gastritis. So whenever we are talking about the gastritis, okay, so what is it? Gastritis, it is a, you can say, just an inflammation of the stomach lining. Okay, means your stomach from internally it gonna inflamed, and there are a lot of factors that cause gastritis. Okay, and that factor can be any type of infection, and any type of alcohol intake, or some medications, okay, that can also leads to gastritis. Okay, and even though you can say the immune system, some immune conditions can also leads to gastritis. And there are two types of gastritis is there. One is your acute gastritis, and second one is your chronic gastritis. Now what's the difference between these two, acute and chronic one? First of thing, the acute gastritis is that gastritis in which it can last for only 2 or 3 days. Okay, means if you are having a gastritis, so that can last only for 2 or 3 days. But if it lasts for 2 weeks, 3 weeks, or 4 weeks, so it means you are having a chronic type of gastritis. So this is what do you actually mean by the gastritis. Now the question arises that what are the main sign symptoms of the gastritis? So whenever we are talking about the sign symptoms, the first and foremost sign symptom is your loss of appetite. Means you are not feeling that you are hungry, okay, and you are always having the feeling of fullness after eating, and a lot of you can say after eating you're having a stomach pain or bloating is there. Okay, and nausea as well as vomiting. Means nausea means you're having the feeling of vomiting, but you are not going to be vomit out. Okay, but and if and other type of sign symptoms that can include sometimes there is a bleeding, okay, in your poo, or okay, that can also you can say in medical term we can call it melena. Okay, and you're always sometimes having a bleeding or blood in your vomiting. Okay, so these are the main sign symptoms of gastritis. In simple language, you can say that gastritis is just type of indigestion. Means whatever you are eating, you are not digesting properly. So that is actually mean by the gastritis. It can be viral infection, it can be bacterial. It depends upon the cause. What is the main causative factor? Okay, and according to that, the medical person or professional, they will start the treatment line. And then how we can judge the patient is having a gastritis in acute term or in a chronic term. From the sign symptoms we can judge that this patient is having a gastritis, or some diagnostic tests like stool test, or you can say blood test, and one there is a one bacterial type of test, that is a H pyloric breath test. From that we can assume, or you can say we can judge that this patient is having a gastritis, and we have to provide treatment line to this person according to this. Sometimes what happened that if you are having on like a acute gastritis, that can be resolved within 2 or 3 days, and sometimes you have no need to take medicines also. But if it's lasting for 3 weeks, 2 weeks, 4 weeks, 5 weeks, then you have to seek a medical attention or medical treatment very soon. And sometimes if you're having chronic gastritis, doctors always given to you like proton pump inhibitors or Pepto-Bismol. So you can say the medications that should be provided to the patient in such a way so that it can provide soothness, okay, or soothe, are having a soothing effect on the internal lining of the stomach. Okay, because I already cleared you that in gastritis, inflammation of stomach lining is there. Okay, so you are not allowed to take like spicy things or alcohol in this situation, because like alcohol and spicy food, that will always you can say irritate the stomach lining, and your gastritis will gonna chronic one. So what you have to do, you have to take like a light meal. Okay, and so this type of treatment that should be provided to the patient. Apart from this, to prevent gastritis, you have to make a good hygiene, like hand washing after taking food, and after going to washroom, and before handling the food. So these type of you can say good hygiene precautions that can help to not getting help you to not getting a gastritis. Although if you're having gastritis, you have to avoid like citrus fruit juices or any type of food that having acetic acid. Okay, and any spicy food which is having a lot of spices and condiments, as well as if you're a alcohol user, you have to avoid that alcohol. Okay, because all these things or all these type of foods, even though you have to avoid junk food also. Okay, so these type of food that can irritate the internal lining of the stomach and will make the gastritis severe. So this is all about gastritis, its signs, symptoms, its treatment, as well as the diet, that what we have to eat and what we have not to eat in gastritis if we are suffering from. Okay, so till then, thank you for watching SKK Classes NZ, and don't forget to subscribe my channel. Thank you.